I'm on my phone for the first time. Just want to see here. Oops. Okay. I think we're good. All right, so hopping on live because it is easier than having to record a video and upload it. So if you hop on this or you can't hop on this, this will be recorded and it'll be posted in the group. So a question I get a lot of the time is, I'm getting my hormones tested from my gynecologist or from my medical doctor. First of all, what should I get? Which a lot of the time, unfortunately, the right stuff is never done. Or I'll see a patient that says, hey, I've already got my hormones tested. Maybe I recommend hormone testing and they're like, I have already had my hormones tested. Everything is normal. So I just want to chat about why I may tell you that it's not. It's not a naturopathic versus conventional medicine thought process. What it is, actually, I don't really know what it is, but here's the deal. When you get your hormones tested, hormones cycle. So I always talk about hormones acting in a cyclic nature. So what that means is at the beginning of your cycle, you're going to have estrogen dominate more. And then in the second half of your cycle, you're going to have progesterone dominate more. That's kind of just breaking it down really in simple terms. So when we're looking at that, it would make sense that if we tested our estrogen when progesterone was dominating, we need to either know that we're doing that, right? We know what time of the cycle we're going, or we need to have a range appropriate for that shift, right? So what I find a lot of the times and what I often come across is my patients will be given the blood work from their doctor and their doctor says, yep, go whenever you can. And so go whenever you can. Okay, I guess that's fine if you actually know where you're at in your cycle, but oftentimes my patient will have their blood work done like February 1st and I'll say, okay, where were you at in your cycle? And they're like, I don't know. So it doesn't give me any information. If you have ever had your hormones tested from Life Labs or from DynaCare or wherever, go ahead and look at your blood work if you have it in front of you. Take a look at the numbers, the ranges. So for example, if you see estrogen, you're going to see estradiol. And beside that, you're actually going to see a few different ranges. You're going to see a luteal phase range, a postmenopausal range, a follicular phase range. And they're different ranges. And if you kind of look at all of the numbers, if we're not actually looking at a range, you're going to see anything from less than 40 to like 2000 and something, depending on what lab you use. So my point being, if you don't know when you went, as long as your number is less than 40 or up to 2000 and something, it's going to be flagged as normal, because Life Labs or DynaCare or wherever else you go doesn't automatically flag you like, oh, this woman was in her luteal phase. It doesn't actually care. That's the information, and that's where blood work is up for interpretation. This is the information we need to know. This is the information I use to determine what the next steps are, or if your levels are in fact normal. So we need to look at the blood work. First thing, we need to know when you went. Second thing, we need to know the timing that you went was actually helpful. So it's one thing to say, okay, I went on day 25 on my cycle for this random estrogen level. As long as you know where you're at in your cycle, that's fine. But a day 25 estrogen is not helpful for me, because when we think about it, when do we need estrogen? We need estrogen to develop follicles at the beginning of the cycle. So at the beginning of the cycle, day 1 is when you bleed. Beginning of the cycle, usually we need a day 3 to 5 estrogen. That'll tell me how your follicles are developing. And so if you've ever been in fertility treatment, you know that usually it's day 3 depending on the clinic, but they get you in between day 3 and 5. You call them on day 1, which is the day your period starts, and then you get that number tested. Now, for fertility and non-fertility, I do things a little bit different, but just kind of across the board, day 3 tells us how estrogen and follicular development is happening, okay? So that's what we need to do there. Other things we can look at there are things like FSH and LH. What does that mean and what does that do? FSH is going to be a marker. It's your follicle stimulating hormone. And so what that does is exactly what it sounds like. It stimulates follicles. And so when we're stimulating follicles, we're stimulating that growth. So we need a combination of FSH and estrogen in order to properly develop these follicles at the beginning of your cycle. And this happens up to ovulation, right? So cases where your follicle stimulating hormone might be too high or your FSH might be too high, this is where we see this perimenopause, menopause shift. So it means that basically you're needing more work or more effort to stimulate those follicles that you wouldn't actually need prior. So having a high FSH does give us a lot of information whether you're trying to get pregnant or not, because it can help me see where you're at in the reproductive cycle when we're looking at symptom management and treatment. So making sure you know when you're going is important. But if you don't have a period or you're having a regular period, obviously you're just going to go whenever. We just need to see what's going on in general. So that is a case where you would obviously just go whenever. But if you have a period, and if you, even if it's not regular, but you do have a period, you want to try to go day 3 to get that estrogen done. The other thing that we need to do is progesterone. Again, you'll notice progesterone doesn't really have a reference range. For example, if you got your iron tested and your iron was less than 5, it depends on the lab again, but if it was less than 5, probably you're going to be flagged as anemia. You're going to say this iron is too low. And then if it's over like 200 and it's like 225 or 250, again, depending on the lab, you're going to be flagged and say your iron is too high, get this checked out, right? So that doesn't matter about cycle timing or anything. That's a pretty like cut and dry. There are some nuances. There are some optimal ranges. I don't like my patients to be at either end of those flags. But all this to say is that your hormones, unless they're your thyroid hormones, your estrogen, progesterone, testosterone, usually take a while to be flagged. Now, in women, testosterone will be flagged because there is a very tight range, because women don't need testosterone as much as, say, men do. But with estrogen and progesterone, it's really important that we know when we're going. So progesterone, you want to go day 21 of your cycle. Again, day 1 is when you bleed. So it's going to be 21 days after that first day that you're going to get that tested. Why? Because after we ovulate, the corpus luteum is going to make progesterone. So you ovulate, let's say day 14. And then what's going to happen is that like egg that's been ovulated is now going to make progesterone as a progest hormone to support the womb, to support pregnancy. Even if you're not trying to get pregnant, that's what happens. And so your progesterone is going to peak about 7 to 10 days after you've ovulated. Why is this important for women not trying to get pregnant? Because looking at your progesterone levels can tell me so much information about your mental health, your mood, your sleep, your inability to lose weight, just in general, your hormone balance. So for example, if you have really painful or really heavy periods, if you have lots of spotting between periods, that could be that you have a progesterone deficiency. Why? Could be because you don't release an egg at all, or because the egg is not very good quality, or there's something going on with it that is not able to produce that progesterone. So doing a day 21 progesterone lets me know, A, are you making progesterone? Did you actually ovulate? We're confirming it. And if you ovulated, was it like a good ovulation, a good, robust ovulation? If you're in Canada and you go to Life Labs, I'm typically looking for any number over 30 to tell me it's like a good ovulation. So those are the timings. Day 3 and day 21 are kind of like the days you should really remember and the days you should really think about if you have a period. Coming back to if you're not trying to get pregnant. Now, obviously making appointments, doing blood work is really annoying because right now there's limited spaces, there's spacing for COVID and things like that. So making an appointment can be really difficult. So typically, and not just because of that, but if you're not trying to get pregnant, normally I'll just tell my patients to go on day 21 and we'll do all the hormones day 21. Why? Because it gives me an opportunity to look at a few different things. I get to look at progesterone. So did you ovulate? Is it high enough? I get to look at testosterone, which really isn't super cycle dependent in women. We don't really need you to go on a certain day. I can look at all of the other things. I can look at vitamin D. I can look at fasting insulin. I can look at thyroid, all the things. And then I can also look at estrogen. And what does estrogen tell me at the time where progesterone should be peaking? When progesterone's peaking, estrogen should not be very high. We need to have a specific ratio maintained for hormonal balance. So on day 21, if your progesterone is A, not high enough, or your estrogen, so let's say there's a few scenarios. Progesterone is normal and estrogen is a little bit low. Then I know that what I need to do is support estrogen, right? Because progesterone is normal, but the reason you have symptoms is because your estrogen is actually low. Now, kind of another scenario that I typically see is your estrogen is normal, but you're not ovulating, so your progesterone is low. I know there I need to actually work on ovulation. And all of these scenarios, you can have the same symptoms. You can have PMS and acne and painful periods and heavy periods and still have all of these things happen. So there are other scenarios, but I won't get into the nuances of it. But this is why we need to make sure that we're really advocating for ourselves when we get things like estrogen and progesterone tested, or when we go for an ultrasound, because you're going to be told it's normal more often than not, because you're going to fall into that range. And if we don't know when you went, and then the range is less than 40 to like 2000. So you got a wide range to be normal within. So that is why I want you to make sure you know when you're going. And if you're not cycling, you can just make that note, because then in a postmenopausal or perimenopausal state, that gives us a lot of information as to whether or not things like bioidentical hormones would be a good idea to add to your treatment plan. So that's it for me. I hope everybody's having a good day. Comment below if you have questions.